Now, besides NAD, what are some of your other favorite sort of treatment modalities that you use in your clinic?
Well, I think our other favorite treatment modality is ketamine. Uh, the other things that we just have a general IV infusion practice as well. So, high dose vitamin C and minerals and vitamins and electrolytes and so forth. I think that there's a lot of people with just such poor and shitty nutrition and chronic stress that just giving them like a Myers cocktail a couple times a week, results in just a major improvement in their mood and their stress levels and in their health. But ketamine is probably the other interesting infusion that we have, and I got interested in that because I I had already been using ketamine in the ER for 20 years. I mean, I've been used ketamine all the time, right, for pediatric injuries and sedation and so forth. So I was super comfortable and familiar with it. And then as this literature came out about how effective it was for treatment-resistant mood disorders like unipolar bipolar depression, treatment-resistant anxiety, PTSD, I thought, oh, that's interesting. And we were already doing infusions. I mean, I already had a nurse here. We're already doing infusions. I already had this familiarity with ketamine. Like, well, let's start doing ketamine. So then we opened up the ketamine center, which is really just an added service to our wellness group. And we've been doing that for a few years. It really didn't get busy until probably this year. It's kind of kicked up the lock a lot, probably post-pandemic. But ketamine has just a very anxiolytic effect and improves depression and relieves anxiety for a lot of people when you do these, these infusions. So that's been a big game changer and added to our arsenal of mental health treatment as well. I think we're still the only ketamine program on the entire Central Coast. I'm surprised there aren't more. I mean, I think it's easy. I think it's safe. I think it's effective. So yeah, so ketamine is a big part of our program here too.
And now with ketamine, is it mainly just the mental health patients that you're treating with ketamine, or do you find
Well,
any efficacy with like treating substance abuse and rehabilitation?
yeah, that's a good question. For the most part, we're using just the standard National Institute of Mental Health protocols for mental health treatment. So the vast majority of patients are depression and anxiety that just hasn't responded to first or second line treatments. Um, that's the majority. The other thing is, yes, ketamine has been shown to have a role in detox and recovery. And there was a paper that showed that ketamine has a role in preventing alcohol relapse and alcohol cravings. Again, probably by just really working as a strong NMDA receptor antagonist and decreasing glutamate, which is excitatory. So that I have used it in opiate and alcohol withdrawal, as well as more prolonged recovery. Yes, I have used it for that. And then there's pain protocols too, which are different. That's higher doses for a longer duration of time. So for perspective, a depression or anxiety treatment is typically like 40 minutes. That's kind of what the standard is. We'll maybe draw it up to an hour for some reasons, but the pain protocols are double the dose over like anywhere from 2 to 4 hours. I'm not a real big salesman on using ketamine for pain. I've had a few patients that had dramatic and lasting improvements in chronic pain from ketamine, but most people don't. I mean, that's just my personal opinion. And when it does help, it doesn't last that long. So it kind of depends on the experience. I mean, I had a guy who really had a miraculous response just a few weeks ago that blew me away. Um, but a lot of times, like when I was using ketamine in the hospital for pain, by the time they were checking out, their pain was back. So I wasn't like a big believer in it, but these higher doses for longer periods of time certainly have a role. I think it depends on the type of pain. So the way I explain it is, if you have a mechanical cause for your pain, ketamine is not the treatment, right? If your knee hurts because you have degenerative arthritis in your knee, ketamine's not going to do anything. But when you have your central nervous system is just hypersensitive because of a regional pain syndrome. Again, typically this is, CRPS or fibromyalgia, or a similar pathway, or maybe chronic back pain that now functionally is just chronically inflamed and an area of sensitivity. I've seen ketamine help that quite a bit. So honestly, all those patients who are coming in for that, they've tried everything else already. You know what I mean? They're not people who are like naive to the healthcare system. These are patients who have been to neurologists that have had pain pumps or stimulators, or you know, they've tried every single medication out there, and now this is their last alternative. Like, yeah, I heard about this, my doctor told me about this. And then these are the guys like, my God, why didn't I do this 10 years ago? Holy shit, you serious? Okay, you know, this is great. So, and if it works, that's great. And then maybe we'll just do a booster every month or every 6 months, or everyone's different. You know, the durability, as we've talked about, is the most unpredictable thing. Like, say we do ketamine and it works great. Well, how long does that last, right? Is it going to last 3 weeks? Is it going to last 3 months? And that is really just a wild card. I have a psychiatrist who comes in for a ketamine infusion once a year. He comes in once a year. He's like, this holds me all year. It's just amazing. No, sorry. He comes in twice a year. He comes in every 6 months. And I thought, wow, okay, well, I mean, you would know. He's just a local psychiatrist. He knows the stuff. And I think that's the exception. I think most people end up coming in probably every 6 weeks for maybe a little booster. But, you know, if it works great, but only lasts a week, I mean, you can do ketamine every single week, you know. I don't know how practical that is, just in time and money and so forth. So it's an individual decision, but I think, you know, there's a lot of information on ketamine out there on the internet and research. So it's clearly a lot more mainstream than NAD. If you start Googling, you know, and researching NAD in patient, you're just not going to find much. There's not much published. There's a handful of stuff, but it's not really good randomized quality, double-blind, placebo-controlled stuff. A lot of it's, I don't know, a lot of it's sort of people selling ketamine. You know, I mean, like, for example, Springfield Wellness Center, who's by far the most experienced ketamine program in the world. They were involved in a lot of the research, and it's good research. I mean, they've brought in external scientists to help design the research protocols and so forth. But, you know, I don't know. They're in the business of selling NAD. So.
Wasting my time.
You just can't help yourself, can you?